Hello and welcome back for another episode of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami. In this episode, I had the awesome pleasure of chatting with one of my dental role models and mentors, someone who I have been following for many years since back out when I was in dental school and, watching his videos on YouTube. And that is Dr. Ashley Mark of All Things Dentistry. Ashley is probably one of the nicest, most humble, and generous guys I've had the pleasure of chatting to, and episode is probably one of my favorite interviews, mostly because I was a bit of a fanboy there, just kind of talking to him about how much I've enjoyed his videos and his teaching and all the things that I really learned from him in dental school, a lot of tips and tricks and things like that they pick up along the way that I use in daily practice. Ashley has been a military dentist for most of his career for the Canadian Army. He's been traveling around, worked in the US where he did his AEGD, and went over to Belgium and Europe for a while, and now he's back in Ottawa, Canada for the past 5 or 6 years. In this episode, we cover a lot of topics. We cover his journey, his teaching. We talk about the origins of All Things Dentistry, which has just blown up on YouTube. He has almost 60,000 subscribers, millions of views, and over 700 videos, which is outstanding stick-to-itiveness to produce such content over so many years. And I know myself and a lot of other people have really appreciated his work and the quality of his content. And it was just nice to get an opportunity to chat with him and just show him my gratitude and tell him how much I appreciate what he's done and contributed to the dental community as well. This episode is brought to you by my good friends at Henry Schein. With over 60,000 products available from consumables, CAD/CAM technology, lab and large equipment, you can always rely on them to be your trusted business partners every step of the way. Ashley has also been working on a few courses, especially for endodontics for general dentists. And I had the unique opportunity to test out the course and see what the content was like. And from a general dentist perspective, it's very practical, very hands-on, and very applicable to your day-to-day practice. I think that if you check out this course, and I'll have the links of the course in the show notes for you, you can actually have an impactful change in how you do endo, starting from the next day at work. So I think definitely check it out if you have the opportunity or are interested in learning and improving your endodontic skill set. I think it is pretty useful to learn a procedure from a general dentist rather than a specialist on some occasions, because they know the challenges, they know the time pressures, and the lack of systemization that you might have in your practice as an associate. So I think it's cool, and I think it's a lot of useful information and tidbits that I've been using since I checked out the course. So I think you'll get a lot of value from it as well. Also, guys, if you've been enjoying the Noobie Dentist Podcast, please be sure to head over to iTunes, give the show a 5-star rating, and if you got some time, leave a review as well. It really does help grow the outreach and expansion of the podcast and try and grow the community a little bit. Also, just want to talk about Foresight Dental. Foresight Dental is a project that I've started with in collaboration with Dr. David Kier, and we're about to launch pre-sales for our Foresight Dental Journal. The dental journal is sort of our passion project, really, to try and put down on paper all the things that we've learned from various interviewees and guests that we've had on the podcast. We're both big on personal improvement and consume a lot of books and audiobooks and podcasts and things like that as well. And we've kind of really just curated a selection of our favorite topics on setting your goals, setting your clarity, and executing on your plans and vision, and created a nice accountability sort of journal for you to write down and track your progress as a new dentist, to make sure you're hitting those targets, to make sure you're actually improving day by day and not just kind of settling for average and just reaching a status quo early on in your career. So be sure to keep an eye on that. Follow us at #4 SIGHT Dental on Instagram and Facebook, and foresightdental.com as well for some pre-sale links and information. And I hope you guys get a lot of value from this because we've put a ton of time into it. Without further ado, enjoy this amazing interview with one of my good friends and role models now, Dr. Ashley Mark.
Hello, and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So I'm here with Dr. Ashley Mark from allthingsdentistry.com on YouTube as well. Someone who, has had a big impact on me in my early part of my career. I used to watch your videos on YouTube. I kind of came across them. So, everything from like surgery to like suturing to dentures, photography. It was pretty cool. I think as you were learning it in your like residency programs and stuff, you'd kind of post it up for everybody else to kind of learn as well, which is pretty exciting and really a nice thing to do to contribute to the profession, which is great. So if you don't mind, Ashley, what I'll do is kind of just get into a bit of an origin story. Maybe talk about your background, like why you decided to get into dentistry in the first place, where you went to dental school, and then we'll kind of take things from there.
Yeah, sure, man. I really appreciate the opportunity to talk. This is actually my first podcast in my life, so it's
that's exciting.
It's pretty exciting. So, and like I said, like we were talking before, I'm sitting here with my beautiful wife. We're sitting in our vehicle, and because we got nowhere else to go with a big family.
Yeah.
And so I got into dentistry, I think, because I never really had any bad stories. Everyone has their story. Either it's money related. I just couldn't get into medical school. Or I wanted a good job. Mine was I saw dentistry as a little kid, and I just wanted to make it different for everybody else. I never had any bad story or no haunting. You've got those patients with those haunting, like, yeah, I hate the dentist.
The knee on the chest and...
Yeah, that's exactly it. Always that knee on the chest, and I still, even going through a program, never saw anybody do that.
Yeah.
And then that was the goal. Like I haven't actually not known anything different to be a dentist. So it's crazy.
So where'd you end up going? Where'd you go to dental school?
All right. So I'm from a really small town in the middle of Canada. Like we were talking before, you're in Toronto. So I'm from Manitoba.
Yeah.
I joke it's one of those flyover drive-through provinces between the west and the east of Canada.
Yeah.
So I'm from a town of about 6,000, and I went to undergrad in a really small school to like 2,500, and then I made it through there, and I got into undergrad in the University of Manitoba. So that's in the city of Winnipeg, which is I don't know, 800,000 maybe, and then. In my second year, I actually joined them. I've always wanted to be it's crazy, kind of, I don't know. I look at it, it's kind of funny. I wanted to be a military dentist my entire life. I don't know why. So I was fortunate enough to apply and actually become a military dentist. And when I remember in basic training, and my wife was in the military as well, but I remember in basic training thinking, this is not what I thought the military was going to be about. So it was, I didn't find it actually quite enjoyable. But, so that's kind of where I went to school. And then, so second year I got picked up in the Canadian Forces, and now it's been 21 years of being in the military.
Oh, that's awesome.
And I keep that actually, I haven't really advertised that. Like you notice in my original videos in the residency, I always had military patients.
Yeah.
But I never really said where I was. Actually, it's a question for you. Did you know where I was?
No, I mean, the assumption was I always thought you were just an American. I thought you're American in the middle. And, I've done this podcast for a couple of years now. So I've had a lot of opportunities to chat with a lot of military dentists, but they've all been like the American guys. So they're kind of either stationed in the US or have been in Europe and stuff. So it's been cool to get their perspective and what they've been like. So I assumed when I was watching your videos, it was the same case and you're just in the US military, like doing a GPR program or something. And then I think when I actually went, it was the first time I thought, like I saw you're Canadian, or I was like, oh, it was weird. Was I went to like contact you on YouTube, and it had like a Canadian flag. And I was like, oh, he's Canadian. I was like, that's the first time I thought or heard or saw that you were kind of Canadian. So that was pretty interesting.
So that's it though. Then I guess continuing after dental school, we got moved around. So I got posted to Ontario for the first time. And then we went to a couple places in Ontario. Then we went to Belgium.
Nice.
My wife and I both moved there. We had 2 kids there, and then I got picked up to go to the University of Manitoba. Yeah. And then we went to, she's giving me notes now.
Yeah.
And then we went to Texas. So we were actually in Fort Hood. So I got picked up to the Canadian side, and then they sponsored us to go to the States.
Yeah.
And then we did the residency down there. And then I ended up then I went to Halifax, went to Afghanistan, and then came to Ottawa. And then I went to Iraq, and then we've been here for 5 years, actually 6 years now.
That's really cool. So you've kind of had a pretty adventurous first, 10 or so years, kind of traveling around, going to different areas and working. So what's it like when you get like deployed over to like Afghanistan and Iraq? So you're just obviously there providing like dental services, or? Well,
that's a very funny question you may ask, because my initial tour had nothing to do with delivering care. It actually had to do with mentoring the Afghans. And actually it was even the next So at that point, the Canadians wanted to get out and close the door. So our mandate was to create a package for them to be able to train their own.
Yeah.
So that's what my time there was, developing this package so we could say, here you go, and they could create their own dental therapist essentially. But when I was in Iraq, I was doing a lot of we did dentistry there, and I loved it. It was just, and honestly, it's really what that residency has trained us for. It's for overseas deployments. So doing stuff that there's no one else around, or the next helicopter is, a 3-hour flight.
Yeah. So you get to have a pretty expanded scope and try out a lot of things, which is pretty exciting.
Yeah, that's what I love doing too.
Yeah. So where are you now? You're in Ottawa, is that right? How long have you been there for?
So we've been in Ottawa for 5 years, and it's been great actually. We love the city. So I don't know if you've been here a lot ever.
I've been a couple of times. It's quiet, like definitely compared to like Toronto. And what I remember, it's been a few years, but I remember my impression of it was really clean. Like it was just like a really clean town. And so I don't know if that's still the case or not, but
oh yeah, absolutely. Yeah, it's beautiful. Like we're sitting down by the river right now.
Yeah.
It's incredible. We love it here. So this will be the end of the road. Yeah, for us.
So you're going to be stationed in Ottawa then for good. No more moving around.
Yeah. So what's going to happen is we have now. So in Texas during the program, my wife gave birth to our third son, and then we went to Halifax. Our fourth child, our daughter, was born, and then we came here. So and everybody's setting down roots, and that's it. So once I get the message to say you got to move, it's going to be okay. Well, I really appreciate my service, and it's time to do something else.
Yeah. So tell me a little bit about the all things dentistry. Obviously, I think I was just going back on your YouTube videos. It's been about 7 years, I think, since you kind of first started that. So I mean, it's pretty cool. I mean, not many people have done that. It's grown a lot. You have like almost like 57,000 subscribers on YouTube. You have over like 770 videos. So you've obviously helped a lot of people. How has that been in your life, in your career, in terms of have you had much feedback? Have you had a lot of people kind of reaching out to you about the content and stuff that you've created? Has it opened up a lot of opportunities for you? What's that been like?
I think, that's such a great question. And, the funniest thing, the reason why it started was, it was two reasons. One, so you're 30 years old. I don't know. Do you have a lot of videos of your dad or your mom when they were really small? Like, or when they were, say, in their 30s?
Not at all. Yeah.
No, and like maybe today it's a little bit different when everything is video and you might see them, but put them online about what my dad was. So my kids can see their dad.
That's super cool. Yeah.
That was really what it was. And so I was like, we'll do that. And then the second was I'm learning all this stuff that is so basic. Like it is ridiculously basic, but some reason we don't learn it in dental school.
Yeah.
And I mean, there was like day one, I was learning stuff and I'm thinking, why am I the only person, like literally, why am I the only person learning this? Why doesn't anybody else learn this? And this can make a difference for everybody else. So that's, that was and actually the other reason was because I'm going to leave. I'm going to not have all these amazing specialists around me. I'm going to go back and 10 years later, I'm going to not remember what to do.
Yeah.
So that's those three things. I really kind of was like, okay, well, what happened was one day I'm like, I asked the director, I'll never forget it. I asked him and he said, can we make some videos and put this online? And he's like, I don't know. So I went up to the commander and she said, yeah, go ahead. And I could not believe it. Like of all things, I mean, I just couldn't believe it because everything was very like everything, especially at that time, even today is restrictive, right? With the military. And she said, go ahead. And they didn't even watch. I don't think anybody's watched them.
Yeah.
And, unfortunately, a lot of them were bad. Like I watched them now. I'm thinking, whoa, that was terrible. Like there's just no intro, like all this stuff. And the reason why is I just didn't have time. Like we had a small family. We had 3 kids. I had this program to hammer through and I got all this other work to do. And I want to put this stuff online. So it had to be cut right then as fast as possible.
Yeah. So
that's where some of it was really bad and some was okay. And I think it's interesting because it's been like I remember looking back, like what happened was I moved to Halifax and I just literally ran out of time.
Yeah.
And I felt like so I didn't have all these people feeding me information, right? So I felt like I was a conduit. And then I'm just like, well, when I got to Halifax, after the program, there's a prosthodontist, there's a periodontist, and then I just ran out of the drive to like this. I didn't have energy
To keep
to keep the content. And then I'm like, who am I? Like, I just need these experts, because there's a lot of expert opinion, but there's also a lot of, so that, you could be doing something for 20 years and it's just worked for you.
Mm-hmm.
But I didn't have that experience. Right. So what happened was it kind of like down to a grinding halt. And then, honestly, I just felt that I didn't have any expertise in something. Kind of like faded away for a while, and then I'd look back and like, that's cool. Wow. I'm like, well, look at all these people watch it. That's cool. And I see all these comments, and I really just kind of like, family and life kind of just kind of kept up or caught up, and we just kind of kept going. And then really what happened was I've always been teaching. I've always had a love for endo. Yeah. Like absolute love for it. And I don't have time to go back to endo school. And quite frankly, I don't know if I'd actually get in, but I just don't have the time. But I love it. And I just taken so much time to hone that expertise. And we've taught our own clinical endo courses in the military after the last 3 years. So now I feel that I have a certain amount of expertise underneath my belt to be able to share what I've learned from others and hone it into endo. So that's kind of what I've been doing right now. I feel comfortable doing is to be able to share stuff in endo practical. It's not like a PowerPoint presentation on bonding agents. So that's kind of where that all came about.
That's really interesting. I mean, a lot of the things resonates with me as well. When I started the podcast, one of my thoughts was as well, if nothing comes of this, no one listens to it, at least my kids can listen back and be like, oh, my dad produced like 50, 60, 70 hours of content that I can like look back and listen on. And
yeah, it's cool, man.
His perspectives and stuff were. So that driving force for you really kind of resonates with me. So that's super cool. So when you were in your residency, was that a GPR program you were doing, or what kind of program were you in, and how long was that? How many years was that program?
Yeah, so the way that program works is that the U.S. Army. So we don't have our own. So it's called an advanced education general dentistry. Yeah. Is it the same as a GPR? I don't know, because I've never done a GPR U.S. Army, and it seems they rotate it every decade. They move it to different places, but they might have just closed one. So the Air Force, Army, and Navy have their own. And the Air Force, we have our own dentists go to an Air Force program, and it's a 2-year program. Yeah. It's in San Antonio. Oh, yeah, it's got a master's degree now, too, yeah. So I missed the master's cutoff. But, and then the Army now still has in Jacksonville, North Carolina, I think it's called. It's Jacksonville. Anyways, it's called Fort Bragg. So there's a residency there. Yeah. There's one in Hawaii, and then there's one in Fort Hood, Texas. So the beauty of the one that I went to is that there are no specialty training centers at all. There's none. Mm-hmm. So what happens is you get everything. Yeah. In the other residencies, there's endodontists, there's pros, there's perio. So what they do is it's just like dental school. They steal all the cases, and then you're left kind of figure out whatever you can get. Right? Nobody's doing restorative, so you can have as many fillings as you want. But we need to get endos done, so it's kind of like you're left with whatever you get. Yeah, I mean, I'm sure that's the way it was for dental school with you.
Well, for sure. I think that's a global trend for sure.
So that was so the beauty of so what happened was when we did a program in Fort Hood, I remember this is a really funny story because we flew in. Catherine can chime in on this too, actually. So we had. We took the boat. So we had 2 kids at that age, at that time, and that was in 2010, the summer of 2010. We didn't want to deal with the time change from Belgium, so we took the Queen Mary or Queen Elizabeth, the cruise ship over. Yeah. Okay, nice. So it took 7 days. So we'd have like every day
gradually,
gradually, right? So we didn't get there with 2 kids in a hotel driving us crazy. So we get to New York, and then we we get into Austin, and that was a nice city, but we stayed right by the airport, and then we got onto a shuttle the next day. So we're coming from this, Europe with this beautiful architecture.
Yeah.
And then we get into near an army base in the middle of nowhere, and the shuttle driver gets lost. And we end up downtown in this town called Killeen, which is right next to the army base. And we're looking like, where on earth did we land? It looks like, if you could imagine any like low down place you don't want to end up, that was exactly where. So she wasn't too, I don't think you were too impressed.
Not a great first impression. Yeah.
Oh no, it was like, it's all tattoo parlors and used pawn shops and used cars, right? So, but what happened was then we moved into we go into the suburb, and we loved it there. We actually loved it. So, and then we started the residency, and like, honestly, at that time, there were two Canadians. One was a junior. We call them juniors and seniors. Yeah. We hop in and we would do rotations in different disciplines. And so that's how that worked.
That's really cool. It's interesting that you say endo is your main sort of passion in terms of clinical dentistry, because looking back at the videos, I would have thought like surgery and stuff is like what you're really kind of really into a lot. Do you think that's changed and shifted a little bit over the years, or has endo from the start been your main like area that you've really enjoyed?
Surgery.
What's that?
I was just saying, you used to always say you wanted to go oral surgery when I first met you.
But it's just, surgery was great. Endo is so like, to me, so what's happened is that in the job that I'm in now, my clinical ability, my clinical time has been reduced. It's an army thing. It's hard to explain, but just my clinical time is reduced. And to me, the most challenging skill of all is endo.
Yeah.
No one really has explained, I don't know, in dental school, no one explains endo. They're just kind of like, drill a hole, get to some working length, put it with stuff in there, and it's all like kind of magic.
Yeah.
And it'll take you forever. Like, it'll take you a couple appointments, so what happened was what happened was, to maintain my skills, the easiest way is through endo, because endo is so tactile sensitive, and it's so complicated that it was able to, that kind of covered everything. So that's why I kind of focused on endo.
Yeah.
Do I like surgery? I'll tell you, man, 2 days ago, I was trying to take a tooth out, and this is the second time I couldn't get him numb. Oh,
yeah.
Do you take a lot of teeth out?
I do. And it's, I kind of, what you're saying kind of resonates, because, in dental school, I love surgery. I was like, I'm going to do oral surgery. And it's like, all I want to do is just take out teeth all day. And then you get into private practice and you're working, and then you can encounter those tough situations where you kind of get stuck taking a tooth out and you run late, and you look at the production versus the stress versus the liability of things can go wrong. You're like, Is it really worth it? Like, yeah.
No, it's not. And you look at the time, it's almost like time flies by in those stressful moments when nothing's happening, and you're like, when you're bored and you have to count a minute, it's like, okay, you and I are going to sit and count a minute. Like, it takes forever. And you're sitting there with a problem, and it's almost like, half an hour.
Yeah.
So my wife is, as you can tell, she's giving me notes.
Yeah.
So I've learned now too, because she's a sedation nurse and she works with oral surgery. So I've learned, I just stay away from, I take out teeth. That's not a problem. I love taking teeth out, but honestly, my experience now has been most people want to be sedated for taking teeth out.
Yeah. It's a much more pleasant experience. Yeah.
Oh yeah, absolutely.
I see cases, and I'm always so happy that my patients are nice and comfortable and sound asleep.
Yeah. I think we prefer that too. I haven't had the pleasure, I haven't had the experience of doing that sedation stuff. I've seen other, obviously, oral surgeons when I'm assisting or rotating through stuff, how much better it is. But I'm stuck doing it with like local anesthetic, and you can just tell they're not happy, right? It's not a great practice builder either.
No, and I think so through the program, I think one of the, I don't know what's happened now. I think there's more videos on it, but I had this doctor, Dr. Partridge. I can't remember the name I called him, but actually, that's really funny because all the doctors' names are backwards.
Okay.
So that's why there's like, you'll see them. Well, one of them, most of them are backwards. So like Dr. Dre's name is actually Dr. Yard, and there's a bunch of other guys. So I gave them finicky names because I didn't want to give them their real names. I don't know why, but Dr. Partridge, which was old. I don't know if I watched it, but I was really I really wanted him. So the beauty of Dr. Partridge is he did the same residency I did in like 1960, and he taught us how to take teeth out without sedation. Like when you have somebody sedated, I mean, the level of anesthesia is probably like 5%. I mean, it's like drug in, cut, hammered out. They're jumping around, and the anesthesia takes place 25 minutes later.
Yeah.
It's not like that with, a conscious patient. So what he taught us was, and so what I learned, and this is not to knock oral surgeons, it's not that, it's that what I learned from somebody who has to be, it's really technique sensitive when the patient is awake. You can't hit them with a hammer. You can't. Like, it is what it is. So as in my residency, the most I learned, the valuable information was from the guy who's been doing it for 50 years, awake patients, and knowing how to section properly, and he doesn't bring out the chisel and bang it in half, and then so that was Dr. Partridge. So what I wanted to do was, so that might be the reason why is the surgery part, because he taught us so much that you can't learn from somebody who works with sedated patients all the time. And they're experts in what they do, don't get me wrong, but the patients are usually unconscious. Would you agree, Kath?
Yeah, it doesn't really matter how well the local works with the sedated patient.
So that's why when I made those, I don't know if you ever saw them. I took these shiny teeth.
Yeah.
I couldn't figure out a way to get him to teach how to use. I thought about it for days, man. So
That's funny.
What did you think of that?
I think it's useful. I mean, I didn't have all the tools to do it myself, but it was fun just to see you doing it, like you drilling the holes and putting like the wax and the teeth in there, and kind of.
Do you know what I'm talking about? Yeah, we did that in the garage. I don't know. I was just trying to think of ways to communicate that information, because it's really hard to do it intraorally because there's cameras in the mouth, and you want it really controlled, Anyways, enough of that.
Yeah.
So that's it. Yeah.
That's awesome. So it's a fair bit of content, a lot of viewers and stuff. Have you had like any opportunities come out of it? Have like any companies approached you? Have you had any like speaking or lecturing engagements and stuff like that come out of it at all?
That's a great question. Honestly, I'm not that I really like the YouTube platform. I love it. And I like it because it's more controlled, not during a program, it's not controlled, but when I create my content now, because now it's really heavy on endo, I can really sit back and think about the message I'm going to give. So I really like that. And honestly, our house is so busy that I do not have time to go. I mean, how many times did we rebook this 2 times? And right now at my stage of career, it's I'm just grateful. I'm super grateful for this opportunity, but I'm also super grateful for people when they put comments. That's huge to me. Like it's very meaningful. And I look at the impact that you can make through the internet positively. Like, you get 1,000 people just watching. If they even watch like 10% of it, maybe they'll get something that'll make a difference. And actually, speaking of you right now, so have I been approached by companies? Not really, but I'm not really out there saying, look, I want to go and advertise for you.
You're looking at marketing with Things.
Yeah, it's kind of, but the thing really with my next post actually in the next week or 2 is going to be the top 5 videos that I've learned from.
Oh, cool.
Yeah. So because there are actually do you do endo?
I do a little bit. Yeah, I do a little bit. It's not my main. Unfortunately, I work in pretty kind of low socioeconomic areas, so a lot of people choose the extraction over the endo. So I get a lot more extraction experience. But I do enjoy it a lot. And actually, later on today, I'm interviewing a couple endodontists here in Melbourne, so I'm excited to kind of get into that.
Oh, that's cool.
Endo with them too.
So like one of the tips that this guy in the UK talks about, like if you do a canine, and I've run into this problem, the gutta percha is too short. Like the gutta percha to fit it into the canal. I mean, the tooth is 31 millimeters, and so what he shows, and unfortunately, he labeled his video is labeled totally the wrong thing. doesn't make any sense.
Yeah.
But when I watched him, like, so what he does is he takes his gutta percha and just rolls out, not the middle third.
Yeah.
Not the apical third, but he rolls out the other part, so it makes it longer.
Okay, cool.
Dude, that is a game changer.
Yeah.
It's like if you're, because if you're doing single canals, that can make a huge difference in the canine. So you leave the apical third because that's where you're, the important part.
Yeah.
And you roll out the top, and then you get like 32 millimeters. You can put it in there to get your working length. Oh man. Before that, I was putting like glue, like I was trying to put a file on the end, like make it so it's long enough. Like, so that's my next post is those types of video, like those, there's 5 of them that have been used.
That's great.
It's incredible. Yeah.
And that's the best thing. These YouTube videos or podcasts and stuff, or even Instagram. And I don't think, are you on Instagram at all? Like in the dental community?
I don't have a lot of time.
So those things are great because you just you're just kind of scrolling through, or you're just watching a few videos here and there, and someone spent hours developing something, and you just kind of pick it up quickly and use it now, right? So that's the beauty of it. You can really accelerate your learning, or just learn these little cool tips and tricks. That makes a big difference in terms of your day-to-day kind of practice. So stuff like that, rolling out the GP cones, I'll have to check that out and see if I can do that as well. That'd be useful.
Oh, it's so simple, and you'll never forget it, man, because you're gonna run it. I mean, you're gonna do a canine at some point in your career.
Yeah.
You'll have the right length of files. Now you got it. That's all because of John Rhodes.
Yeah.
So he's a UK economist.
Okay, cool. I'm excited to check out that video when you publish it.
You should actually message him and see if you can talk to him.
Yeah, for sure. Yeah, I'll look up when you post the video. I'll find the link from it, and I'll get in contact.
Very cool.
So tell me a little bit about like your current practice. I know you said you've been limiting it more to endo. I know you're using like a microscope and stuff. So what's that? Yeah. Like what's your day to, like what's your average week like right now in terms of clinical work?
For the last 5 years, my practice has been limited in terms of dentistry. But as of Monday, I go back to doing a full regular day of dentistry, which is amazing. So what's happened was, because my clinical time was limited, I focused on endo, and I'll never forget buying my first microscope. I was like super excited. I was super cheap, so I got it super low price. And then what I did was I just worked on extracted teeth, working. So what happened was I took the risk of, because I'm at the point in my life where I need to retire and find a real job. But I kind of want to go away from doing just fillings and like hygiene checks and fillings. Man, that's a long day.
Yeah,
I'm sure. Is that what you're up to?
I mean, as a new grad, I've been out for 2 years now. So a lot of the bulk of what we do is just basic, restorative and extractions and checkups. Not a whole lot of like advanced, indirect work and things. They come about every so often, but still definitely very much in the basic restorative treatment.
Yeah. So, I've been doing this for a while now. So what I wanted to do was see if I can just do endo strictly. So I focused just doing endo, and I've now, in the military, that's what I do. But outside, so a couple of private clinics, I've been just doing endo for them, and it's been a lot of work, but it's been absolutely amazing. I love it. I'm not an endodontist, and I don't pretend to be one. So I'm not tackling retreats. I'm not tackling apicals, but what I am doing is start to finish routine endos, and that's where what I find again. So I'm going to go back to. I was just thinking about this the other day. I'm going to go back to like oral surgeons. So surgeons, they've been trained in sedating patients and hammering teeth out.
Yeah.
Endodontists, they're used to using their specific, like they walk in, everything's set up.
Yeah.
They've got the ultrasonic, they've got all of this. General dentist does not do that. A general dentist walks into the operatory, everything is like all over the place.
Yeah.
They're pulling endo files out of the drawers, and that's where I believe where my expertise lies in, because I have to set all this stuff every time I go into a clinic, into the operatory. We're there setting it up out of the drawers, and it has to be efficient.
Yeah. Because
the operatory is not set up for endo. It's set up for everything. Mm-hmm. So that's where my expertise now is, trying to translate those little tips and hints of doing endo in general practice. Because most people don't have a microscope, right?
Yeah.
They don't. I mean, it's just it's too expensive, and
takes
to learn
room
it's room, it's everything, but they want to do endo. Mm-hmm. So why not? Let's guide people to tackling endo that's useful for them, that is actually profitable, but they get great outcomes, you know? And I don't know if you've had this experience, but taking your file down a canal and it doing this.
The heart
Have you
stop.
had that?
Yeah. That's when your
what
heart
do you
thinks, yeah.
You sit there and you try to twist harder.
Yeah.
You know what I'm talking about?
Yeah. The heart stop is the worst. That's when you know things are going to be, it's going to be a long afternoon. You're like, oh man.
That's exactly it. And you know, the secrets are so simple, man.
Yeah.
They're so simple to fix that problem. And so that's where I right now am super passionate about taking that hard stop and making it into something so you don't lose your confidence and you're not like, I hate this, I'm not doing it again.
Yeah.
Where if you can do a premolar with a post and core in an hour, man, that's like an awesome feeling. It's an amazing feeling, right?
Yeah.
Yeah. And then you bring them back for a crown, patient's happy, you're happy. I mean, it's an amazing feeling. And I think I know that's totally achievable.
Yeah.
So for me, just to communicate that in my videos right now, that's really what I want to do.
That's super useful.
Because I know it's a struggle, man.
And now a short ad break from our sponsor. Henry Schein has a complete endodontic solution for your practice. Their vast range of products include everything from diagnosis right through to retreatment. With brands you can trust like Merida, Coltine, Edge Endo, Comet, and Septodont, you are guaranteed to find everything you need. Interested in learning more about endo? Henry Schein also runs hands-on endodontic courses. Visit henryschein.com.au for more information. I think it's such a great point because, you know, when I work as an associate out of a couple of practices. So, you know, it's different systems, it's different setups. There's the endo patient. The nurse hasn't done endo in like a month. So they're looking at the technique cards like, what do I need? What do I pull out? So nothing is like systemized. So you're kind of, you know, figuring things out on the fly as you're going. So it definitely is a lot of inefficiencies in that. That's why I think the treatment time and everything kind of gets spread out and you get frustrated. The patient gets frustrated. So I think it'd be really handy if you can, like, I mean, if you're working on that and that's something you're kind of passionate about, to kind of create like a systemized way of doing this a little bit more efficiently. That'd be like really handy.
Yeah, you know, absolutely. And it totally is. And that's where I'm really geared towards. And honestly, I'm not paid by Dentsply, but I don't know if you've used Wave One Gold.
Yeah, it's a good system.
That is indestructible.
Yeah.
It really is. That has made me confident in moving towards private practice to do this. And that's what we train. That's what I mean, it's just ridiculous. Like, yeah. Is it as efficient? Does it preserve as much tooth structure as, say, True Shape, True Anatomy, or even any of the other types of files that are just Constant Taper 04? No. Mm-hmm. But you give up a bit of tooth structure for absolute almost certainty of not breaking something.
Yeah. Which is worth it. It's a good trade-off. Yeah.
Oh, it totally is.
Yeah.
So we were talking about what's my day look like. Well, what's going to happen now is I'm just starting to do a lot more guided. So we got the guided implant surgery stuff.
Yeah.
The toys for that. So that's part of my next my YouTube project is to, I don't know if you've placed implants.
Not yet. Something that I really want to get into. I've been kind of taking some courses and stuff, so slowly kind of get in there. But it's tough as an associate also because I feel like if I'm not going to necessarily be at a certain practice for a long time, I don't want to start placing them and then not be around for the follow-up care and things like that. So that's just something like a hurdle that I don't know if it's like just like my personal mental block about it or it's the right thing to do. So I'm not sure.
It's both. You know what? I totally understand what you're saying. Like, there's the one, you know, I'm just doing endo for one office, but I see they have the implant stuff to do, but then you're kind of like, how do I get is the nurse assistant properly trained? Mm-hmm. Do they have the right stuff? Am I going to get halfway through this and it's all going to fall apart, the procedure? But what I can say is that my advice is that if you do start doing basic implants, learn how to do the guided ones are going to make your life so much easier. Oh my gosh. Like even not fully guided. What we do is we do the first drill and then that just gives you the basic firing line. And then it's so simple, man. Like It really is. And that's, so that's kind of what, so doing a lot of endo, taking teeth out and implants, and actually, to be honest, I love doing ortho as well. Really basic ortho, like my own, like super basic.
Yeah.
But it's a cool thing. I don't know if are you guys using Invisalign? Do you do that stuff?
Yeah, it's getting huge here as well. So Clear Correct and Invisalign and those yeah.
Yeah. So doing that, that's kind of my basic load will be now, just those types of those things, and lots of teaching, because that's what my job is now in the Army. I love to teach and just teaching. Like my job as a senior dentist is really to pass on the mistakes. Like I was talking to a young guy 2 days ago. I'm like, all these mistakes I just told you about, I don't want you to do them. You can make your own.
Make new ones. Yeah.
Yeah, you can make new ones, but I'm telling you, that's the reason why we're in this organization that we work, is that so we can pass on all that stuff so our patients actually get a better outcome. And really that's what YouTube, that's kind of what all the dental people on YouTube are trying to do. They're trying to like pass on their information. So we don't, you don't replicate that error. But for example, let me just tell you one example.
Sure. Yeah.
So I don't know if in our private side, you just have to send an X-ray before you do a crown to the insurance.
Yeah.
I'm not sure if that's the same for you guys.
So we're pretty lucky in Australia. We don't have that, because I worked in Canada for a year after graduating. So I remember that process of like getting pre-approved for things. Luckily, they don't have that system here in Australia. It's just like kind of automatically approved. So you just kind of swipe their insurance card and it's good to go. So it's a big difference in that regard.
Wow. So that's amazing.
Yeah.
So one of the interesting things is that what I found is that it's the normal pattern for, even because they come out of dental school, the normal pattern is to take a PA before you do your crown preparation.
Mm-hmm.
But I will never forget, and I never posted this story, but I was doing an endo like 3 years ago on a friend of mine that he was in Belgium with us as a military police, and he needed a root canal done. So I'm into the tooth, and I see these two like silver things in the pulp chamber. And I'm thinking, what on earth, what the hell are those things? It looks like, like prison bars.
Yeah.
And I'm like, so I figured it out. What happened was I don't know if you were taught how to use pins. Do you remember using pins?
Yeah. Yeah.
So somebody had placed pins into the tooth, and, you place a pin, you look, you make sure there's no blood coming out.
Yeah.
Right. That's what I would do. Like, no blood. We're going to go. So they placed the pins into the tooth. No blood came out. Restored the tooth. Well, what happened was the tooth was dead before they even restored it. Right. Yeah. So what I preach now is, because I've seen this several times where the crown is done without any type of cold testing.
Yeah.
So what happens is the tooth is necrotic. I mean, months, years before that. Before the crown was done. So, and then what you see is a reduction in my heart. You're seeing a reduction of the outcome of that tooth, because now we know that with lesions, with endo lesions, the probability of success is a lot lower, right?
Yeah.
So cold test any tooth you do before you're doing a filling or a large restoration or a crown, and then do the endo even before it needs that crown.
Yeah.
So that was so stuff like that, right?
Yeah, those are just great lessons, right? It's practical tips that you might not pick up in a textbook or like in dental school. It just comes from like years of experience and kind of doing it wrong, and you're like, oh, I should have done it the other way. So I think it's definitely valuable to get all these lessons. And like I said, it does kind of like time collapse your learning. If it took you like 5 years to like learn all this stuff, and you just telling it to other people through a video, they can learn it in 5-10 minutes, right? So that's pretty special.
No, absolutely, man. 20 years worth, not 5 years.
20 years. Yeah. I guess time flies by. I mean, I'm 2 years out now, so I'm already like my back and neck are sore. So I'm trying to I can't imagine doing it for 20 years, but I guess we'll get there eventually.
Oh, you should see this guy I work with downtown, it's a private clinic. He's like 70 and he runs around like a tornado. He's ridiculous. I can't believe it. No back pain, nothing.
Wow. Good
and
stuff.
he's like this. He doesn't use a dental system for half the time. I'm like, I don't know how oh man. I'm telling you, like, it's, dentistry's hard on the body.
Yeah, for sure. It takes its toll. So what's the dentistry like in Ottawa right now? Is there like the saturation levels and stuff that you hear in some of the other big cities? Is that pretty similar in Ottawa or?
Yeah, it's huge. I mean, it unfortunately is saturation's pretty high, and that's unfortunate. And actually, it's really high for everyone. It's high for endo. It's high for ortho. Oral surgery, I don't think there's just one huge practice. It's not that saturated.
Yeah.
Perio, it's unfortunate. I think, who was I talking to? I don't know if it's just a money, I hate to say it's a money grab through universities to bring more international students in. I don't know what it is.
Yeah.
Because it is actually quite crazy.
Yeah. Which is kind of why you started this. Like, we didn't want to go into private practice. There's so many practices. So you're now keeping everybody's endo in-house, right?
Yeah. So I just want to do my endo. I'll go to a few clinics and we'll see how that works. I mean, I love what I do, right? So,
well, it's a good business model from your end of things. If you have that one specialized thing that you like to do, you get to just do it in other practices and not worry about the overhead and not worry about like all the headaches and stuff like that. So you just kind of go in, do what you got to do, and you can leave at the end of the day and not have to worry about anything, which is nice.
I think, absolutely. And, I honestly, man, I can't say how grateful I am for the career that I've had, especially for the military. I haven't had to deal with that stuff. And I would say, as a plug for any armed services for people to go and do it, get that experience, because you get a breadth of experience, and then you don't have to deal with, you're still an associate, so you don't deal with that business part of it, right?
That's right.
So it's, it gives you the opportunity. Like right now you're learning a lot of stuff. You don't have to deal with all the other baloney. You just kind of focus on you until you jump.
That's great. So what's the plan for the next, like, say, a few years for the All Things Dentistry kind of project that you've been working on? What do you kind of envision it heading towards?
Oh, man, plan. I don't know. I wanted to actually, one of the things, so it's more focused, more like cases, but more endo stuff. And I think what's going to happen is that I'm going to kind of open back out to more surgery stuff. I don't know. We'll see how it goes. I think the world is kind of going towards more obviously computer-based stuff. So what I really wanted to do is I've connected with one of our oral radiologists. You know what's really cool? I don't know have you sat through an oral radiologist lecture before?
Like in dental school once, but it's been a long time. So I would probably appreciate it a lot more now, having been working and kind of seeing the benefit of it.
Yeah, man. Like they'll run through. They see all these crazy wacky like cone beam cases. Yeah. And then they just like, oh, well, this and that. And then they show you, they're like, oh, well, that is that. And you're like, whoa, crazy. So there's a guy. So, that's probably one of the sweetest jobs possible. You just read 3D radiographs. You charge somebody $50 and it's done. Right. So I wanted to get him on very similar to this, do like a Skype thing for him to run through some cases.
Yeah.
That are totally benign. It's not like this huge like broken jaw and third head coming out of here. It's just like stuff you wouldn't pick up on an x-ray. Here's the clinical symptoms and you're like, oh. So that's kind of where I want to go with All Things Dentistry as well. That kind of like open up to things that you don't normally see, because not a lot of people, there's not a lot of oral radiologists that are, it's pretty boring, I think, for the most part. But and then I think just trucking along and seeing where we go. Like, honestly, answering questions, that's a big thing as well.
Yeah.
Taking the questions what people ask and just cutting a quick video, posting it, and then finding, and that's about it. That's really where it's been now. It's just answering people's questions. That's
great. I think it's, the online learning and online courses and stuff is a great kind of future, because especially for new grads, because I was the same way. Like when you're working, you're not necessarily like booked out all the time. So you have gaps in your schedule and stuff. So that's like really good time that you can use. If I'm at work, let me just focus my time in like doing dentistry. So even when I'm not working, or if I have like a patient doesn't show up or I have a gap in my book, I'll just hop onto like an online course like Spear or like AEGD and stuff. And I'm just like, consuming courses and content. So I think, like you said, the online thing is really cool. If you're going to get into kind of making courses and interviewing some other people, I think it'll be like really valuable for a lot of new grads. So you'll be providing a lot of value, which is great.
Well, it's cool. So my wife is, but yeah, I have I'm a hard time because I've done this content for so long. And what I did was we created a course we created a course online, so we're slowly getting it out. It's for basic endo stuff as well.
Yeah.
So the difference for me is that what I love about I've taken what I've taught and what I've practiced for the last 3 years and made it into a practical. Actually, you know what I should do is I should send it to you. What I'm going to do is I'm going to practice. Once we're done here, I'll send you the link to it so you can take a look at it.
Yeah. I mean, like I said, you've been, you know, I'm very honest and genuine. I try and be anyways. And genuinely, like I know your videos and I know the tooth block and the wood block, because I've literally, like, I'd be in dental school and I'd be on All Things Dentistry YouTube and I'm watching your stuff. So definitely from my perspective, you've helped me a lot. So that's why I'm happy to help you in any way. So let me know if there's anything I can do, and I'm definitely ready and willing to kind of repay that. So.
Yeah, no, thanks. I really appreciate that. Obviously, it's hard to move from, because I've been in a socialist system my entire life. Right? Yeah. An army patient shows up. You're like, what do you need? Like, they're like, I need this. Okay. And then you just say, well, you're going to do this. And they're like, okay. Actually, my only currency, this is what I've kind of led myself to believe anyways, is that our only currency is time. Yeah. Is literally time. So if they're deploying to overseas in a certain period of time, then we can't do anything. Like, we can't do a certain amount of treatment. Yeah. Otherwise, pretty much time is the currency, and their willingness to go through it because it's all free. Yeah. So that is the beauty in which the system I practice, because we don't have to fumble with fees. But it's also a downfall because they don't, and like you just said, they don't appreciate it to a certain respect, right? Yeah. When you get something free, it's kind of like, well, that was great. And then, okay, see ya. And then it's like, oh, well, we just did, like, literally, I'll never forget one case, we spent, $30,000 on it. And you just like, okay, see ya, I'm moving. Ciao.
Overall, I think for me, one of the drawbacks of dentistry, like one of the stuff that I don't really love is the lack of kind of job satisfaction in terms of patients, like appreciating the amount of like time and effort you put in, especially when they're when they're paying for it, because they like, well, I sat here, I paid for it. So they're not really grateful. So that kind of hurts. I think as someone who tries to, you get into like healthcare and stuff to try and help people, and you don't necessarily get that appreciation back, or they'll sit down in the chair and literally I'll get this like at least once a day, like, oh, no offense, but I hate the dentist. And so that kind of stuff kind of gets to you a little bit. So it's cool to, if you can somehow create that appreciation or get that feedback, that'd be really helpful, making dentists really enjoy their job a little bit more, I think.
I'm going to ask you a question. Would you have the time, here's the first question. Do you call your patients the next day to see how they're doing?
I do, for like, if I'm doing something a little bit more expansive, like an endo or like a surgical extraction, I'll call them like personally. Otherwise, for the basic kind of stuff, the practice will call them and follow up.
So that's one way I've found, is that fills that gap for myself. Whether the patient, if they do appreciate the phone call, I hear what you're saying, and I find that phone call the next day fills that gap to me, because it's like, oh, okay, well, at least they're okay and they appreciate the phone call, because they're not going to appreciate the amount of frustration in whatever you're doing. You're kind of like, oh gosh, this is not going well. Yeah. Whatever it may be, but at least because I mean, actually I've thought about this a lot with my wife and I, is that there's a lot of times where you can't say anything. You are literally sweating and your mouse is, the hamster's running in your head like, oh my God, how do I solve this problem? Yeah. And I can't vocalize anything. And then the procedure's over and the patient's like, thanks. And then they run out and you're just like, I'm emotionally wiped because it was so, yeah. You know what I'm talking about?
Oh, for sure. And because as a professional, as the clinician, you can't even like, your face can't show. You need like that nice poker face, right? You're inside, you're like dying. You're like, I'm wearing a suit. I'm like, this is like, my life's over. And then on the outside, you're like smiling and trying to be calm. So it's like, it's like this internal like hurricane, and you're just like on the outside, you're like just like, out for a walk on a sunny day. So
yeah, that's exactly what it is. It doesn't change after 20 years, man.
Yeah.
It's the same thing. Just like, I think everything just becomes even, you're just like, oh God, I don't know. That's that. So that was one of the things that's how I get around that lack of appreciation, is just calling the
follow-up crap. That's a great perspective. I haven't thought about it that way. So that's pretty cool. Because you do feel good. Like when you make that phone call and they're like a little bit appreciative, or they have like that one or two questions and you just answer it. That's like the one time that they're like, you get some like that satisfaction, job satisfaction out of it.
Yeah, absolutely. And then what it does is the next layer on top of that is, and I'm sure you've done this. It just it helps them it helps. So the two things it does for me is, one, it gives them I give them my direct line. So it's like they got a phone call, so they know exactly. They never call. I mean, once in 20 years, man, somebody's called. So they feel confident about what you've done for them.
Yeah.
The second is that it allows them to alleviate any of their fears that they're feeling afterwards. It's like, well, I'm feeling this. It's like, okay, well, we talked about it. I gave it on the sheet, and then you can reassure them.
Yeah.
And then again, the third one is just that kind of like self, kind of like, oh, I get to feel good for 30 seconds at least, because everyone else hates the dentist.
Yeah.
Seriously.
No, that's right. Yeah, I think, the struggle, and one of the things to learn as you go forward is, like you said, try and find these little pockets of where you can get that job satisfaction, because you need it to kind of keep going and not get burnt out and not kind of get over the job a little bit, right? So if you can figure out little pockets or little ways to connect with people or to get that job satisfaction, I think that's really valuable. Awesome. So to wrap it up, I'll kind of go through a quick rapid fire, just some like light and easy questions to close things up. So what's your favorite pizza topping?
Oh man, we just had pizza today.
Yeah.
It's got to be bacon.
Bacon?
100%
bacon. Yeah. If you weren't doing dentistry, what career path would you be in?
Pilot. 100%.
Pilot? Yeah.
Yeah. I have my pilot's license.
What's like your favorite tooth to work on?
Favorite tooth?
Yeah.
I don't know. No, not. Yeah, 8's for my wife. And then I guess upper maxillary molar.
Yeah, upper molars. Yeah. What's one procedure in dentistry that kind of makes you question your career choice?
That was taking out that tooth the other day. That was one. I couldn't get him, like the mesial papilla would not numb up, man.
Yeah.
I mean, papilla. Yeah. Every time I touch it, so I'm just like, he's totally numb. Everything's numb. The whole face is numb.
Yeah.
So surgical extractions make me really think like. But the real one, actually, my real answer was in dental school, because I always want to be a dentist. But I remember doing dentures. My first day in denture class, I'm thinking, if I knew that I would be playing with wax, and I didn't know how dentures were made. I had no idea. Yeah. But if I knew they were made of wax, I probably would not have been doing this, because it was just
it's very tedious. I had a similar case. I was cementing a crown. This is like last week, lower 6, like 3/6. Fully numb, like one spot on a tooth. Every time I touched it or water touched it, she would jump out of the seat. So I was like, what is going on? I tried like everything, like, inferior alveolar nerve block, like gout gates, like infill, PDL. Eventually I was like, luckily she was the last patient, because I'm running like an hour late for this like crown cementation. So luckily I sat her up. I'm like, just sit here for 10 minutes. We'll give it some time and see what happens. Finally she got numb. And so one of my, I tell people one of my like biggest assets is like I'm very persistent. Like I don't give up on things, but it's also one of my biggest like drawbacks, because I won't give up on a surgical, even if it's going like an hour and a half. I'm like, I'm getting this root out. Like I'm not going to stop.
Oh my God. Yeah. So I'm going to tell you something that I learned from Frank Spear about those teeth.
Yeah.
Is I don't know if after you prep them, do you put gluma on them?
I do sometimes, but now mostly because I'm doing like onlays and stuff, like the biomimetic stuff. I'll do like an immediate dentine sealing kind of procedure. Like
because that's what I learned. I didn't know that, and I'm just like, oh, that works out well. So, anyways,
so gluma's good tip. Yeah. So, what's your favorite band or artist?
John Mayer.
John Mayer. Yeah, he's good.
I love that guy.
Awesome. Ashley, thank you so much for coming on the podcast. It's been pretty cool for me, having heard you and seen you in so many videos over the years, to have the opportunity to kind of chat with you and talk about your journey and your story and what you got planned for the future. I'm excited, and hopefully it'd be great to, I'm more than happy to kind of check out your course for you and give you some feedback. And
I really appreciate the time. It was amazing.